Animal testing, also known as animal experimentation, animal research, and in vivo testing, is the use of non-human animals in experiments that seek to control the variables that affect the behavior or biological system under study. An estimated of 26 million animals are used every year in the United States for scientific and commercial testing. Do you know? Descriptions of the dissection of live animals have been found in ancient Greek writings from as early as circa 500 BC. Physician-scientists such as Aristotle, Herophilus, and Erasistratus performed the experiments to discover the functions of living organisms. Aristotle believed that animals lack intelligence, and so the notion of justice and injustice did not apply to them. In 1242, Ibn al-Nafis provided accurate descriptions of the circulation of blood in mammals. This complete description of the circulation was later provided in the 17th century by William Harvey, which discovered that the heart circulated blood throughout the body and not the lungs, as a result of his experiments on living animals. And in the 20th century, especially in 1996, Dolly the sheep was born, which is the first mammal to be cloned from an adult cell. Throughout history, there are many acts of animal testing and have been continued even to this day. At the same time, there has been growing concern about both the methodology and the care of laboratory animals used in testing.
Since 19th centuries, modern medicine and public health have boosted the average lifespans in the United States by more than 30 years. The improvement in survival reflects the diagnosis of certain cancers and improvement in treatments. Many diseases that once killed millions of people every year are now either preventable, treatable, or have been eradicated altogether. Immunization against polio, diphtheria, mumps, rubella, and hepatitis have saved countless lives. Animal research plays a crucial role in developing these vaccines. Taking one of the examples, the Nobel Prize winning works with rabbit tell us much about the drug L-Dopa, which provides initial relief from tremors in patients suffering the debilitating symptoms of Parkinson's disease. In the long term, some victims may benefit from the implantation of an electronic stimulator in the region of the brain that controls body movement. Or maybe taking the current issues, even with the vaccines of coronavirus or COVID-19 undergoes thousands times of animal testing samples before the confirmation of its effect, not even having some trial on human candidates to ensure its safety and effectiveness without any side effect. Without animal testing, the production of the vaccine will be delayed more than 5 years and above to achieve a safe and effective level.
Traditional Christians believe that animal experiments are acceptable if they result in benefits for human beings, for example, advance in medical treatment. They believed that human beings were greatly superior to animals. They thought that human beings could treat animals as badly as they wanted to because people had few moral obligations towards animals. Modern Christians generally take a much more pro-animal line. They think that any unnecessary mistreatment of animals is both sinful and morally wrong. Animal testing should not be used if there are suitable alternatives, and that animals should be treated humanly and their suffering minimized. Buddhists say that this is morally wrong if the animal concerned might come to any harm. However, Buddhists also acknowledge the value that animal experiments may have for human health. Buddhists requires the experimenter to experiment only for a good purpose, avoid killing the animal, and treat the animals concerned kindly and respectfully. Using animals for research may be permitted in Islam. The animals must not suffer pain or mutilation, and there must be a good reason for the experiment. According to the spirit and the overall teachings of Islam, causing avoidable pain and suffering to the defenseless and innocent creatures of God is not justifiable under any circumstance.
Animal testing, it benefits humans in some way. It has advantage of life-saving medications and vaccines. the landscape of modern medicine would unquestionably be vastly different without animal testing. For example, research on dogs in which the animal's pancreases were removed led to the discovery of insulin. Animal testing also reduces the risk of human health for cosmetics products. Testing of cosmetic products on animals before the products are introduced to the public is a common practice during the manufacturing process, otherwise humans would be using potentially harmful products. Inhuman treatment in animal experiments is highly possible. Usually they are being restrained and some of them are routinely force-fed, forced to inhale nauseous compounds, and so on. It's very common that animals' eyes will be held open for hours. Animal testing is lack of applicability. This is because animals are not humans. Since animals and humans have different metabolism and they react differently to the substances. It works for animals but may not work for humans.
There are possible solutions regarding animal testing. First of all, the 3R's principles as the guideline that helps researchers to achieve the goal of more humane experimental techniques, which stands for replacement, reduction, and refinement. Replacement means that prefer using non-animal methods over animal methods whenever possible on research and testing. Reduction is the finding methods that use less number of animals in experiment to obtain comparable levels of information. Refinement is to minimize the potential pain, suffering, or distress, and also enhance animal welfare for the animals' use. Therefore, these principles not only encourage alternatives to animal testing, they also aim to provide the welfare of the animals that are used in testing. Alternatives to animal testing. Experiments on animals are crude, expensive, and generally inapplicable to humans. So the vitro method tests are using human cells and tissues, computer modeling technique, silicon models, and research with human volunteers are the solutions to prevent cruelty to animals. Example in vitro method is organs on chips which contains human cells grown in a state-of-the-art system to resemble the structure and function of human organs and organ systems. These chips can get more accurate response on human physiology, disease, drugs, and toxicity testing than crude animal experiments do. Another example is using vitro cell machines which are used to expose human lung cells in a dish to chemicals in order to test the health effects of inhaled substances. These devices replace the current method of forcing rats into tiny tubes and making them inhale toxic substances for hours before finally killing them. In computer modeling technique, the development of wide range of sophisticated computer modules which can simulate human biology and disease progression that helps researchers to replace the use of animals in exploratory research. These modules can predict accurately on how the new drugs will react in the human body. Companies and governments are avoiding animal testing of chemicals by using quantitative structure activity relationship QSAR tools as the computer-based techniques. These QSAR tools are able to predict physical, chemical, biological, and environmental fate properties of compounds for the knowledge of their chemical structure. Example for research with human volunteers is functional magnetic resonance imaging (fMRI), an advanced brain imaging and recording technique which human volunteers can use to replace arcade experiments in which rats, cats, and monkeys have their brain damaged. Researchers can temporarily induce brain disorder using transcranial magnetic stimulation. That's all for our group.